everyone, and welcome back to Series 2 of Lunch Orders, where we are exploring all things bodies, and I'm pretty excited about it. So we're starting with a very special guest. Um, Before I introduce her, I would like to acknowledge the traditional owners of the lands on which we meet. For me, that's the Wurundjeri Woiwurrung people of the Kulin Nation. And for Melissa, who I will introduce in just a moment, this is the Gadigal people. So I would like to acknowledge the traditional owners of both of those lands and the lands of any traditional owners that people are watching this live stream from. I am very, very thrilled to introduce to you Dr. Melissa Kang. Most people might know her as the longest serving expert behind the iconic Dolly Doctor column, but she's also a practicing medical doctor for marginalised young people and has academic roles at the University of Technology, Sydney and the University of Sydney. She's a fifth generation Malaysian Chinese Anglo-Australian, which makes specialising in adolescent sexuality and sexual health all the more interesting. She continues to speak about these topics in the mainstream media. Melissa has co-written with Yumi Stein's Welcome to Consent and Welcome to Your Period, among other books in the Welcome to series. A little bit of a content note for this session. We are going to be talking about bodies, and we're going to be talking about them in quite explicit terms. So like all of Melissa's work, like the Welcome To series and like Dolly Doctor, we're not shying away from the awkward questions or the explicit questions. So be warned, if anything makes you feel uncomfortable, feel free to take a moment or come back to the recording when you feel ready for it. All right, Melissa, over to you. Thank you for joining us.
Thanks so much for that lovely introduction, Beck. And hi, everybody. So I'm Melissa Kang. I am a GP, a doctor who specialised in working with young people. And I've spent my whole career mainly being a doctor, talking to young people, seeing them in clinics, but also doing research with young people around how they access healthcare and also kind of their concerns around sex and sexual health. But for many, many years, there was a magazine which no longer exists called Dolly. And it first came into being back in 1970. So I can promise you, I was born then, but I was still very, very young. So I didn't start reading Dolly magazine until I was a teenager in Sydney, although I grew up in Malaysia. So I kind of see myself as coming from two different cultures, different backgrounds, two different countries. I spoke 3 languages when I was a child. When we came to Australia, I hit my teens and started reading Dolly magazine. And by sheer coincidence, when I was a GP and a doctor, I was working next to a GP who was then the Dolly Doctor, answering questions that mainly girls, but sometimes boys, would write into the magazine for. And then I took over from that other GP and wrote for Dolly Doctor. They used to send in questions and the magazine would ask me to answer them. And I did that for 23 years until the magazine actually closed down. And that's about 8 or 9 years ago now that it closed down. So many of you will not even have heard of this magazine, but certainly people probably from their 20s and 30s upwards will remember Dolly Doctor very well, because it was one of the only places where you could get good information about bodies and about relationships and things to do with sexuality and things to do with anything that felt really private or a bit squirmy or embarrassing. So what I'm going to do is I'm going to read out some of the questions that were sent to the magazine during the years that I was writing Dolly Doctor. And I'm going to just I've grouped them into categories. And what I'm really trying to show you is how embarrassed and how kind of ashamed it seemed to me some of these young women and girls were writing about, how they were feeling about their bodies. So the first group of questions are really about what happens at the start of puberty when the body starts growing. So here are some examples. Dear Dolly Doctor, I'm a 13-year-old girl. I am very overweight and have tried lots of different diets. They just don't work. What should I do? And she signs it Fat Slob. The next one, I'm a 12-year-old girl. Lately, people have been telling me how skinny I am and all. I mean, I tend to eat a lot and everyone knows it, but I never gain weight. And then she says, it's really annoying because I'm so bony and all. And people in my school have been going around telling everyone I'm anorexic. Tell me, is there something wrong with me? And then finally, I'm a 13-year-old girl and I'm very concerned about my height and weight. And then she goes on to tell me what her weight is and what her height is. And she says, I think I'm overweight and I'm too small for my age. I'm not interested in sport. I've been on lots of diets. I always fail. Nothing ever works. So those three examples are, these girls, perhaps they're underweight, perhaps they're overweight. But the problem there is that there's such a sense of shame and kind of desperateness. There's something wrong with me. I'm a fat slob. I'm really very concerned. So when I answered questions like that, it was really just explaining what happens during puberty. And that's a really intense time of life when various hormones in the brain trigger all this growth and development. Every single part of the body grows during puberty. And obviously, it grows, it happens much faster in some people, much slower in others. And it can start anywhere between the ages of 8 and maybe 13 in girls, and 9 and 14 in boys. So you could have some, say, 13-year-olds who have almost finished all their growth and development, and some who are just at the start. So you've got this huge variation. And what I used to notice in these kinds of questions was that if you are at the early end or the late end of starting puberty, that's when that self-consciousness and embarrassment seem to be the worst. So I'd get writers writing in saying, everybody else is fully developed, or everyone else has got their periods, or whatever it might be, and I'm the one left behind. Or the other way around, I have been going through puberty since I was very young, and everyone at school teases me. So a lot of self-consciousness about their growth and development. The other thing that happens really quite intensely in puberty, and we don't talk about it very much, is what happens to our skin and hair. So here are a few examples. Dear Dolly Doctor, a couple of months ago, I started noticing pimples on my back. They just get worse, and I want to know how to get rid of them. I had never had pimples on my back before until now. They're really ugly and I hate them. What can I do to get rid of them? Why did they suddenly come? Here's another one. Since I was 13, I started waxing my legs, but after a while, my legs went extremely dotty, as if where the hair had been pulled out left little holes. I stopped waxing and I started shaving, but after a year, my legs are still really dotty. My friends have asked me about it, and I feel embarrassed to show off my legs. I want to get rid of these dots. Can you help me? Here's another one. I'm 14 and have very hairy eyebrows, and I always get teased at school, and my boyfriend says pluck them. I try, but it hurts, and now I don't have friends because they call me names. What should I do? And here's another one. I'm 15 years old, and she goes on about how much she weighs. I have stretch marks on my shoulders, stomach, and under my breasts. I'm too embarrassed to see a doctor, and I can't wear singlet tops because people can see them. And there's a bit more to that story too. And then, dear Dolly Doctor, I am 17. I play a lot of basketball. I train every weekend and I sweat a lot. I have showers after, but I still smell. I use a lot of deodorant and try to smell nice, but that doesn't work. So what happens to the body during puberty, and this is for everybody, whatever their sex or gender, they get increases in the amount of body hair. So if you are a boy or male and have male genetics, then you're going to get more body hair and facial hair than girls. But girls also do get an increase in facial hair and body hair. And there were a lot of questions to Dolly Doctor about the hairiness that they felt they had, and how uncomfortable it made them, how embarrassed they were. They wanted to always know how to get rid of all this excess hair, even though for most of them, from what I could tell from reading their questions, it was completely typical of what happens in puberty. Sometimes it would seem like there might have been a hormone imbalance, but you can't diagnose that from a letter. So I advise them to maybe go and get checked out, and gave them information about how they could go and see a doctor and not feel too uncomfortable about it. But the sweat glands also change during puberty. So the sweat glands that lead to body odor or BO, they're a different type of sweat gland in the body that appear in the armpits and in the groin area. And they're the ones that can, because of skin bacteria that live there and live off those sweat glands, they can lead to a little bit of a smell. And there was often lots of questions about how embarrassing that was as well. And the final thing is about removing hair, and there are lots and lots of questions about that, and getting skin rashes from removing hair, and wanting to know how to combat that. Okay, and then the things that happen in the body that are, I guess, they were the most frequent sorts of questions, were about what I call the sexual development. So the changes that happen in puberty that are related to sexual development, the body changing to becoming what we call sexually mature. So one group of those questions were about breast development, and here's a couple of examples. Dear Dolly Doctor, I'm 11 years old and I'm reaching puberty. My breasts have started developing, but one is bigger than the other. It makes me very embarrassed and self-conscious. What is it? Where does it come from? And how is it fixed? And here's another one. Dear Dolly, I am 16 years old and I don't think I'm developed. I have boobs, but they're size A. That's not the problem, just that my nipples just look the same as it's always been, whereas women's are usually bigger. I have some pubic hair, but it's not really thick, it's not very high up, and isn't it supposed to go right up to your undies line? I also have some hair under my arms. Will guys hate me because I'm not developed? When will I develop? So there were lots and lots of questions about breast development and boobs, and the fact that they were asymmetrical, the fact that they were too small, too big, too lopsided, nipples were too big or too small or too dark. Lots and lots of real worry and beyond curiosity. I think it's quite okay and normal to be very curious about what's happening to the body, but there was a lot of anxiety and distress and thinking that they would not be attractive sexually to a potential partner when they were a bit older. So those kinds of questions. And I guess the answers to questions like this is that asymmetry, so two parts of the body never being the same size, whether it's your hands, your feet, your ears, or your breasts, is completely normal. They are never exactly the same size. And also it can take quite a few years for breasts to reach their adult size. And you go through all sorts of changes over that period of time. There were always a lot of questions to do with the genitals, the vagina, and periods. So here's just a couple of examples. I'm a 13-year-old girl and I'm worried about my vaginal area. My flaps, which are meant to be inside the vagina, they're actually hanging out. They've been like this for years, as far as I can remember. Please tell me what is wrong and how can I get this fixed? I am really embarrassed and not normal. Another example of talking about vaginal fluid. Dear Dolly, I'm 12. I found clear gel looking stuff on my underwear. It is inside my vagina. It is so freaky. I don't know what it is. And another similar one, I am 13 and every afternoon when I go to the toilet, I find a white, gooey mucus thing on my underpants. What is it? I'm deformed. So these are very, very typical normal changes that happen during puberty for people with vaginas and vulvas. Sometimes they get the terminology mixed up, and in my answer, I would explain what the difference is between the vagina and the vulva and explain the different structures, or what we call anatomy, in that part of the body, and how the growth and development varies over time. It starts younger in some people, finishes older. I talk about where pubic hair grows, where it doesn't grow, about what we call the vulval lips or the lips. They were often referred to as vaginal flaps by readers of Dolly, and how they're asymmetrical. They can be all sorts of different shapes and sizes. Sometimes the inside lips would stick out beyond the outside ones, and so on and so on. But there was a lot of real concern about the genitals when girls were looking at them, and also a lot of concern about what they would call vaginal discharge, which was the clear fluid that is normal when puberty hits and your hormone levels reach a certain level in the body. You get a lot of natural lubrication of the vagina until your period starts, and then you start to get um, every month or so you'd get your period, and in between your periods you'd also get this sort of clear vaginal fluid coming out as well. And then finally, there were many, many questions about periods. For example, something like this. Dear Melissa, please help me. I have this problem. I only got my periods this year in May, and then I got them in June, and then I got them in August for one day. And people say it's because I'm skinny, but I'm really more concerned about my breasts. And then she writes on about her breasts and how she can't wear bikinis. So there's a bit of a mix of things where her periods are a little bit irregular, which is completely normal in the first 2 years. You often miss several months before you start to get a regular pattern. Many, many questions about periods and about how to manage periods, particularly difficulties with using tampons. So that's a quick summary of some of the questions about bodies and changing bodies that were the most common sorts of letters that readers would write into Dolly. And just so we don't make people who are not who are boys or who have male genitals not feel excluded, there were always some letters from boys, but not very many. But in a way, they were similar. They were worried about their bodies, about their muscles, about their height, about body hair and shaving, and also about genitals as well, and kind of the appearance of genitals, but also how the genitals worked. So people with a penis and testicles would also be writing in about those body parts and whether this was normal or not. So that's just a really quick run through some of the very typical kinds of questions that thousands and thousands of readers of this Dolly magazine would write into the magazine to the Dear Dolly Doctor column. And I guess what really stood out for me all the time was just how self-conscious and embarrassed or worried or anxious the readers were. And I think up to a point that's kind of typical of this stage. I remember myself what it was like to be a teenager and how self-conscious I felt about my body and not wanting anyone to look at it or to make comments on it, but never completely satisfied. And I think that's often a typical thing for adolescents. But I think that part of the problem is that we have a way of perhaps having an ideal kind of body that we might see on magazines like Dolly, and writers saying, well, I don't have a body like that, therefore there's something wrong with me. And I think that that's a real kind of stigma and way that we see ourselves that I'd like to see changed. So I'll get off my soapbox now and be very happy to have a bit more of a chat with you.
No, thank you so much. And it's funny, it took me just right back. I was in high school in the 90s, and so I was exactly the generation of Dolly Doctor. And I just remember hearing and reading all of these letters and, feeling so seen, even if the exact experience didn't match my own, just knowing that other people felt as awkward and weird as I did. I wonder if or where, in the absence of Dolly Doctor and in the absence, in fact, of the same engagement with magazines that we had during the 90s and early 2000s, where are teens getting information about what is normal for their bodies, and is that information adequate?
So that's a really good question, and one that I often wondered when the magazine closed. We know that most young people get information about health and bodies and all sorts of things from the internet, from different websites. We also know they get information from social media, so that can be simply through friends and peers, but it can also be particular social media sites and perhaps influencers and people that they follow. There is some really good information on the internet, excellent information. There's also some good information on social media. But I think the difficulty now is figuring out what to believe, kind of where the maybe the best or most reliable sources are. And also when you hear really conflicting facts about changes in the body, that's when it can get really confusing. And I think it's really important to acknowledge that there's lots of different um, ways that people try and manage, for example, something like painful periods or pimples and things like that. There's lots of different kinds of treatment for those conditions. And what can be confusing is when you read that something's really bad, and yet that's what perhaps, your mother has recommended or your doctor has recommended. So I think that's where the risk lies in on relying on everything coming from the internet or social media, is that it can be very, very confusing. But that seems to be where most people go. The other place is that they still talk to their friends. And the other important source of information is parents and carers, is that parents have been through adolescence themselves to get to this point. And so they can talk about some of their own experiences and, where they got help from. And then school is the final place, but it's not really the place where you can get really specific tailored information. And it does depend on the school, and it depends on how much time the teacher has to teach some of these aspects of health and growth and development. But young people say that they do get some good information from school a lot of the time as well.
I mean, it does seem like a lot of information does come from adults, but I almost have this sense that adults are becoming more and more awkward and clumsy at talking about bodies. And it's funny because, I know that there has been some controversy around the series that you've written with Yumi. Um, and I had an adult come up to me and say, what do you think about this book? And I said, I think it's amazing. And she said, we didn't have anything like it when we were young, like the two of us. And I said, no, we didn't. And I'm kind of approaching it like this really positive thing. And then she did that unexpected backhand where she said, and I don't know why we can't just continue to do that. Like, why couldn't we just leave things as they were? They were fine. And I was like, well, they weren't really fine. I mean, myself and everybody I knew felt quite messed up about bodies and how to talk about them. Do you have any advice at how we might normalize talking about bodies and why it's so important to normalize talking about bodies, from genitals to weight to hair?
Look, I've got particular views, and I think that I suppose I do feel over the 23 years of answering questions from particularly young women, girls, was that when children hit puberty, and it is when your body starts to physically mature into its final adult kind of state, I suppose. Um, that is when we start to see this kind of double standard divide happening between, for young women particularly. And so that is one of the reasons why I think it is so important to talk about bodies and to give all young people information about not just their own bodies, but other young people's bodies, what is happening. So I like to draw the parallel between how we are okay teaching children in school about how their digestive system works, what happens when food goes in the mouth and through the digestive system. We're fine talking about how the heart works and how it pumps blood around the body, or perhaps, parts of how the brain works. We're also quite happy teaching children and young people about, things which we're concerned about, like using drugs or alcohol and the effects that can have on the body. And yet, when it comes to what I'm calling sexual development, which is what really happens, that's the kind of centerpiece in a way of puberty, even though you grow in height and muscle mass and bulking up and everything grows in the body during puberty. It's because of the sexual development that suddenly we get really, really embarrassed and we stop talking about it. So there are still women and girls in the world who don't even know what periods are. They don't even know how to manage it. They're not given that information because periods are associated with reproduction and therefore sex, and that becomes very taboo. Now, that is just, in my view, a travesty. How can we not teach young girls that this is what happens naturally to the body, this is why it happens, and this is, how we can manage it, and what to do if you're worried about it or if you're experiencing some problems with your periods. The same with breast development. Breasts are there really in order to feed infants, and that's what all mammals produce. They have bodies that produce milk to feed their infants. Now, that doesn't mean that's what you have to do with them, but they become sexualized during puberty and in adulthood in such a way that people then feel embarrassed. And we also know that boys develop breasts as well. Everybody's born with some breast tissue. And for quite a high percentage of boys, there will be a little bit of breast development, and that's to do with the hormone fluctuations. So boys get really embarrassed too. They think somehow that they're not, man enough or masculine enough because their bodies are responding to puberty hormones and growing some breasts. So there's a whole lot of shame that goes on sometimes also with being a male and not having the right kind of body. And I think that's why it is so important for children and adolescents and young people to just get the facts. This is what happens. It doesn't mean you're this or you're that. This is just what is happening to your body because your genetics and nature, and this is what it is to be a human being. So I think for me, that's the reason why it is so important that young people are given all the information, including about sexual development and genitals and periods and breasts and all that kind of thing.
Um, it's been 30 years between Dolly Doctor and the publication of the series that you've done with Yumi. Have our attitudes towards bodies changed much? Have bodies changed much?
It wasn't very evident to me in reading the letters over 23 years. So I noticed some changes. For example, I gave the example earlier with one of the letters talking about vaginal flaps and just that misunderstanding of the different anatomy, the different structures in that part of the body, and the difference between what a vagina is and what a vulva is. So I would be able to answer those kinds of um, misunderstandings, I suppose, and kind of give the correct names for those body parts. And I saw that knowledge did improve over the years, in the sense that people writing in would start using the words that related to the structures that they were talking about. That was one thing I noticed. But otherwise, I think there was still a lot of, I guess, just a lot of embarrassment and shame about what was happening to their bodies, and concern about having the ideal kind of body weight and height. And that was true for some of the boys' letters as well, but obviously there weren't nearly as many compared to all the girls. So unfortunately, I think there's more willingness to talk about bodies, particularly about the genitals or the private parts. I think there's more talk about it. There's more words out there in social media and so on about different body parts that were previously very taboo to even mention. But I'm not sure that that's really made a huge change yet in how people feel about their bodies.
It seems like shame is the root cause of a lot of the things that we struggle with in our own bodies and in the way that we approach other people's bodies. Perhaps even why there were fewer letters from boys in Dolly, feelings of shame, of being seen as something. And I mean, the sign offs, the names that people used to sign off for those Dolly Doctor letters were always so profound. They were kind of like a hashtag insult that revealed the negative way that so many of us looked at ourselves. And it made me quite sad to listen back to that, to listen to that sense of that tone of shame coming through in those letters that you read. We are at the end of our session. What would you say to those readers, like outside of the advice on specific body issues, when it comes to the shame and embarrassment? What do you wish all those readers and all those people who look at themselves and call themselves those names, what would you say to them?
So the advice I'd like, or I guess the question I'd like to leave you all to think about is the question that I was asked so often in trying to answer those questions that were sent in by readers to the magazine, which is, how do we learn to really be grateful for and to love the bodies that we have? That's what I'd ask all of us to go away and think about, because our bodies are amazing, even if they could be, even if they are a little bit, can't do everything we want them to do. Like, I wish I could have been a much better athlete, for example. I just don't have that in me. I don't believe I have that in me. Or we might want to think about healthy eating and healthy weights and how to get our bodies being really fit. That's just that's kind of, that's okay to have those kinds of issues to be dealing with. But it's about really embracing and loving our bodies, because we have them for the whole of our lives, and we can really, if we can put that shame and embarrassment behind us and go, my body's great, I'm going to get it to do, you know I'm going to be grateful for all that it can do to me. And I guess I'd like to leave that with you to think about, how can you be really grateful for and love the body that you have.
Great. Thank you so much, Melissa, for joining us and for being so frank and generous with your time. Thanks also to our education partner for this series, VATE, the Victorian Association of the Teaching of English. For those of you who have signed up for our mailing list for lunch orders, you will have now received the curriculum resources for Series 1, which you can go back and watch. And we are hard at work developing curriculum resources for Series 2. And I'm pleased to say that some of the topics we'll go on to explore in this amazing series about bodies will include talking more about how we can unpack feelings of shame and embarrassment and start to feel really great in the bodies that we're in. So thank you so much, Melissa, for kicking us off. Thanks everyone for joining us. I'll see you next time.